Hello friends, today we are going to discuss about continuous professional development which is notified by the National Medical Commissions under the RMP's Professional Code of Conduct Regulation 2023. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about continuous professional development program which are notified under the National Medical Commission regulation. This professional conduct regulation was notified on 2nd of August 2023. These regulations are very important and all the registered medical practitioner need to follow. And these regulations, if you see, there are 5 chapters and 11 important guidelines. Today in this video, I'll be discussing about the continuous professional development guidelines, my dear friends. That is guideline number 10, which is notified under the Professional Code of Conduct Regulations, my dear friends. Let's discuss about this continuous professional development. As per this guideline, it discusses about the aims and purposes of CPD, the organization which can deliver the CPD programs, how the delivery and the review of this program, what are the guidance for the registered medical practitioner, special consideration with regard to CPD, CPD credit points, role and responsibility of the state councils in this CPD program, building an evidence based for the future of CPD in India, logistics, proposal for accreditation committee, tables and various forms will be discussed in this video. What are the aims and objectives of the CPD? As you know, earlier we used to do CMAs, continuous medical education. Now, there is a new term which has been coined, that is continuous professional development. Although this is a term which has been borrowed from Western literature, it appears to be suitable for this context. The main objective is, as you know, the practice of medicine is continuously changing and newer technologies are coming day by day. Further, newer diseases are emerging and they are discovered, such as COVID-19, my dear friends. Further, there are new technologies have been invented and newer diagnostic system, newer therapeutic systems, and also these newer technology comes with bioethical issues. Hence, RMPs need to undergo training. Further, because of the information and technology, the public, that is general public, is growing, increasingly becoming aware of the health-related issues and increases their expectation of the health professionals' accountability and responsibility. Hence, in this regard, this guideline mandates every RMPs to undergo continuous professional developmental program, my dear friends. Now the question is, what is the difference between CPD and CME? As you see this table, CME is a continuous medical education, which used to be episodic, and these events usually related to a group of learners. This was speaker-centered, targeting only specific skills. The format is fixed and it is podium-based. Now, the NMC clearly talks about CPDs. Here, it is a lifelong learning with self-assessment addressing the educational needs of the healthcare professional. It is learner-centered rather than the teacher-centered. It not only talks about individual skills, but a comprehensive set of skills, both in the discipline and also interdisciplinary, across or cross-disciplinary skills need to be taught. Here the format is flexible. It can be didactic, it can be workshop format, video-based learning, doing and learning, seeing and learning, and also the RMPs are made to learn certain skills by practical demonstration, and it has to be based on adult learning principle, that is It should be based on andragogy, my dear friends. Usually, this type of CPDs are usually workshop based with wide variety of interaction should be planned. That is CPD, my dear friends. Here, as I mentioned, in CPD, it focuses on wide ranges of competencies, not just one or two competencies, wide range of competencies beyond clinical skills and update and knowledge should be focused. This CPD focuses on research, scientific writing, writing for funding, multidisciplinary context of patient care, ethical practice, communication skills, management and behavioral skills, team building, leadership skills, information technology, auditing, financing, and also appropriate attitudinal changes should be brought in an RMP to practice safely in the consumer era, my dear friends, so that the patient outcome and patient satisfaction should be the primary focus. Now the question is, who are those organizations who can deliver CPDs? This NMC guideline clearly says that RMPs, professional bodies, associations at the state level, national level, and international level can deliver CPDs. Medical colleges permitted by the NMC will be allowed. Hospitals approved for DNB program. Research institutes involved in healthcare research will be allowed for CPD programs. National institutes like AIIMS, NIMANS, and other institute of national importance with regard to healthcare can be given permission to do CPDs. Governmental organizations such as National Disaster Management Authority, National Institute of Disaster Management Authorities can be given CPD permission. Institutions involved in healthcare training and education can also be given permission to do CPDs. How to apply for this? Institutions who aim to deliver CPDs need to apply for the EMRB board for permitting them to deliver CPDs. And this can be directly to EMRB or through the State Medical Council. There are forms which will be released by the EMRB. Those forms need to be filled and applied to the NMC. All SMCs will play a special section of CPDs in their web pages. SMCs, that is State Medical Council, will grant CPD credit points and maintain the database records of RMPs who are undergoing CPDs will be done by the State Medical Council. Further, the organizations who are providing CPDs have following responsibilities. Responsibility number 1 includes developing CPD program, identifying the speakers who are well versed in this area, obtaining approval to conduct CPD from the State Medical Council, disseminating information regarding the CPD to ensure enrollment and participation of RMPs in the CPDs, conducting CPD and obtaining feedback from the participants, submitting a report of the CPD to the State Medical Council or EMRB of the National Medical Commission. The grading of the professional bodies. If a professional body has applied to EMRB regarding for permission to conduct CPDs, they are assessed on 10-point scales. This includes whether the professional organization or a body is it registered under the government or in the society's various legislation, whether this body is recognized by the EMRB or not, whether it is a state level, national level, or international level, how many events per year it is conducted, and if it is conducted in the past, how many they have conducted, grading of the events, type of events, whether it is online, physical, or hybrid mode, what is the transparencies of these organizational bodies, whether there is a financial audit, whether they have a website, and number of members of this professional body. The scoring is done from 1 to 10, 1 being the poorest or the lowest score and 10 being the highest score. Not only that, CPD delivering organization, when they apply for EMRB for registration, they need to pay 25,000 rupees, and this organization will be recognized for 5 years, and after 5 years, they need to renew their permission to do CPDs. These organizations need to identify the speakers and take permission 2 months in advance for applying CPD credit points from the SMC. The program should be delivered into 70% category 1 and 30% category 2. I'll be discussing about this category 1 and category 2 CPDs. Further, the people who are conducting the CPDs should online update the CPD credit points so that the EMRB and SMC come to know who are the people who are participated and how many points they have gained. CPD committees will be formed under the EMRB of NMC so that these CPD committees will do quality control of the CPDs and also accredit certain organization whether they can do CPDs or not, so that our continuous professional development programs are in parity with the international standards of medical education and training. That's the important aim which the NMC is having a plan to raise our CPD to that level. Let's understand what are the categories of continuous professional development program. There are 3 categories. Category 1 is within discipline training program. Here 70% of the program can be devoted to the knowledge updates and skill updates with specified subject area essential for patient care. For example, if a pediatric organization is doing a CPD, 70% of the time should be devoted with regard to pediatric related knowledge, skill enhancement. And that is within the discipline. Category 1 should be devoted. Category 2 CPD. This is interdisciplinary or transdisciplinary or cross-disciplinary training. 30% of the time should be devoted with regard to cross-disciplinary such as bioethics area, research related, statistics related, communication related, public health related, policy related, biostatistics, technology related, or else the comorbid conditions which can cut across various other super specialities and other specialities, that cross-cutting disciplinary 30% time will be devoted. Category 3 is self-directed online CPDs, that is online learning. Further, scholarly work with regard to publications come under the category 3. Let's discuss about category 1. Category 1 is offline and it is discipline based CPDs. If you look at the category 1, it talks about the column 1, talks about description of what type of category it is. The column number 2 talks about CPD activities, and the final one is credit rating, how the rating is done. Here with regard to category 1, activities that have been deemed to meet the set of administrative, educational and ethical standards established by EMRB of the State Medical Council or the NMC, and only recognized bodies will be considered for doing CPD. Activities organized by pharma, drug companies, or any other equipments or devices will not be eligible for CPDs. They are very clear about that. And 70% of the time should be devoted here, and it should be offline, that is in person. It can be conferences, symposia, seminar, workshop, online synchronous or blended learning activities can be considered. Here, 0.25 credit hours will be given. That means for every hour of work of CPD, 0.25 credit is given. That means if the participant spends 4 hours, he will get 1 point. An invited speaker in the category 1 will get 1 credit hours, and it should be national or international speaker. For a local or a state speaker, 0.75 credit will be given per hour. Oral presentation, 1 credit score, and for poster presentation, 0.5 credit hour will be given. Moving to the category 2, it is also a offline but it is interdisciplinary or cross-disciplinary. Again here, those CPDs which are organization which are recognized by the NMC, EMRB board will be eligible for that. Again here, for every hour, 0.25 credit score is given. Here the CPD activities like group activities, simulation, workshop, demonstration, exercises will be considered. Research activities, biostatistics, epidemiology activities, public health related activities, telemedicine, telehealth related, digital technology related, any training of the doctors with regard to communication skills, leadership skills will come under category 2, my dear friends. To get 1 point score, the doctor need to spend 4 hours in category 2. Category 3 is online. And this online, it is not more than 50% will be considered for category 3. Here, it is most of the time asynchronous learning, which is self-paced directed learning, where a repositories of videos will be kept, where the doctor will see these videos, will do certain assignments and get the score. Here again, for every 1 hour, 0.25 credit will be given. That means to get 1 credit point, he has to spend 4 hours. Here it can be webcast, podcast, attending online webinars will be considered. Further, it also talks about publication. Publication, editor of a journal of a recognized association, society or an organization, if you are editor, you will get 1 credit hour. If you are an author, for one book, only 1 chapter will be considered per year and it is 0.5 credit hour will be given. For original article, which is recommended by NMC, recognized journals, 1 credit hour will be given. Further, for systematic review and review article and meta-analysis, 0.5 credit hour will be given. Original article in the PubMed indexed with the impact factor for more than 2 credit hours will be given. For reviews, letter to editor and commentary, 0.25 credit hour will be given, my dear friends. Please remember, for category 3, being online, he cannot take not more than 50%. That means you cannot take, for every year, a RMP should get 6 credit points. He cannot take more than 3 points under category 3. Now let's understand the CPD credit points. The CPD credit points must be obtained every year and RMP is expected to obtain 6 CPD points every year. Not less than 3 credit points must be obtained per year. A minimum of 30 CPD credit points must be obtained over a period of 5 years for renewal of license to practice. Earlier, there was a relaxation for senior citizens and academicians. Under this new CPD regulations, academicians, senior citizens need to undergo training and they need to get these CPD credit points. Let's understand how these points should be gained. For category 1 and 2, which are offline, 0.25 credits will be given per hour. For every 1 point, he needs to spend 4 hours. For every year, he needs to get at least 3 points under category 1 or 2. That means he has to spend 12 hours. To get a 3 points, that is 12 hour means 1.5 hour, 1.5 day training program he needs to attend. That is in-person training, my dear friends. Category 3 is offline, that is online. It is maybe webinar or else podcast, various online teaching platform can be used. For every hour, 0.25 credit points are given. To get 1 point, the RMP need to spend 4 hours online. To get 3 points, he has to spend 12 hours. That is 1.5 day of training program. Online should be done to get 3 points, my dear friends. What is the format for rating of these CPDs? Every state medical council observer will visit the CPDs when it is occurring, and then it will be monitored and it will be rated. Here, the NMC proposes Kirkpatrick model of CPD evaluation. What is this Kirkpatrick model? Kirkpatrick will talk about 4 levels of assessments. Level 1 is reaction of the person who is undergoing training, that is the participant. How did they react after the training program? Level 2 talks about learning, how much they learned at the end of the training program. Level 3 is what is the impact of this training program, that is whether there is an attitudinal change or a behavioral change. The level 4 is results, how much impact of this training program has occurred on the patient outcome is the level 4. Let's understand again the Kirkpatrick level 4 CPD evaluation. Here in the level 1, delegates reaction after the training program. Level 2 is pre and post assessment, what is the difference in their knowledge after the CPD program. Level 3 is attitudinal and behavioral changes of the RMP after the training program. And level 4, what is the result of the CPD on the patient's outcome with regard to mortality, morbidity, and the disease outcome. That is the level 4. Level 1 and level 2 is easy to assess, and it is immediately pre and post. Whereas level 3 and level 4 is very difficult to assess. Here level 3, over a period of time, what is the behavioral changes which has occurred in the RMP and the attitudinal change which has occurred after the CPD. For example, if an RMP has undergone training in January, you need to do the assessment at least after 3 years, whether this training program, what he attended in January, whether it sustained during the month of March and April, what was his attitudinal change, behavioral changes which has occurred. Further, you need to do the assessment in level 4 with regard to patient's outcome with regard to illness and also with regard to morbidity and mortality. Further, the SMC observer will do the assessment with regard to the duration, whether it is 4 days, 3 days, 5 days, and the scores will be given as per that. Assessment of the speaker's qualification, content of the quality, validity of the content, and communication skills. And further, the program content and quality and workshop will be considered. How it was organized, time management, academic environment, speaker's presentation, speaker reputation, and feedback responses. These are the various parameters on which the SMC observer has to rate, and rating will be done from 0 to 100. Here, if there is the total CPD program gets 80 to 100 grade, that means it's a grade A level program. Grade B, if the scoring is between 60 to 79, grade C is 40 to 59, ungraded is less than 40. Now there are various forms which have been recommended by NMC. First and the format is format for organization to get recognition for conducting CPDs. This is the form 1 which the professional bodies, medical colleges, and various other health institutions, INI need to apply to the NMC to get the eligibility to do CPDs. Here, the name of the organization, medical colleges, the branch, and the parent organization if it is there, whether it is a registered body, whether it is registered under a charity or a corporate body, a copy of all those informations, documents, statement of CPDs which was conducted last year, name of the president of that organization, name of the secretary and their addresses, bank details in which the delegates' fees will be coming there, name of the bank account, name of the bank, and also PAN card details and any other important details need to be shared by the CPD organization which is going to conduct CPDs. Please note, whenever the official communication is going by the CPD organizations which are conducting them, it should be from the official email of this organization or association and institute, and it should be to the MRB, and they need to pay 25,000 rupees to get recognized or to become eligible to provide CPDs. Hard copy of the application along with the necessary required document should be sent to EMRB within 15 days of online application. Further, the certificate will be valid for 5 years once the EMRB gives permission to conduct CPDs. There are form number 2, format for certificate for delegates. This is how the certificate should be given for the delegates who participates in CPD. Form number 3, format for certificate for the faculty. This is how the certificate should be given to the faculty who is going to provide the CPD training program. He will be considered as a resource person. Either it may be a workshop, seminar, or conference. And this format should be followed. Form number 4, template for evaluating the impact of CPD. Form number 4, which talks about how the evaluation of the impact of CPD. Details of the CPD experience by the participants should be captured. Impact of patient care by undergoing the CPD. How did it impact his patient care? And the reflection of the delegate on this training program. Evaluation strategies. In what way they evaluated? Whether it is a workplace-based assessment, gathering feedback from the patient or colleagues, further learning needs, whether there is any improvement required, and how those improvements need to be done will be given in this feedback. And also, all the delegates need to fill this pro forma after the completion of the CPD activity. And 0 should be very poor and 5 is an excellent program. The minimal is the score versus the CPD program. The least will be 1. The highest scoring per variable is 5. Based upon that, the CPD activity of that will be rated. Further, gain in knowledge and skills by the delegates need to be asked, and additional information if they require, how they contacted and how they learn further will be commented by the delegates. Now, the question is, who is going to fund these CPD programs? As per the NMC regulation, it is very clear. It should be predominantly from the delegates' fees. You cannot take money from the pharmaceutical companies to do CPDs. And CPD, it should be conducted in the medical colleges or in IMA halls. Every medical college has their auditoriums. IMA halls across the country can be utilized for the CPDs. Further, 50% of the CPD points can be gained by online attending the programs. Please remember, taking funding from pharmaceutical companies is prohibited. Further, when CPD's programs are done, please avoid lavish dinner, cocktail parties, entertainments, doing CPD activities in 5-star hotels. Event management companies are hired so that they also get cuts, and all these costs will be borne by the patients, my dear friend, at the end of the day. Hence, NMC is very clear. The nexus between the pharma and the doctors with regard to CPD has been completely prohibited. To conclude, my dear friends, CPD activities have been structured and streamlined under this regulation. There are various 3 important categories of CPDs have been formed. That is CPD 1 and 2, they are offline. Category 1 talks about within discipline training programs. CPD 2, category 2 is of interdisciplinary or cross-disciplinary based training program. 3 is online training program. And various organizations need to apply to EMRB board to get recognition to do CPDs. And please remember, every RMPs need to get 6 credit course per year and 30 over a period of 5 years to renew his license to practice, my dear friends. And It also talks about Kirkpatrick model of evaluation of CPDs so that our CPDs are in par with the international level of training. Post CPD evaluation and the format has been given, and clearly no pharma involvement in CPDs have been dictated by the NMC. And this is a revolutionary step with regard to CPD activities and to curtail the pharma's influence over the doctor's prescription, my dear friends. Thank you very much for giving your valuable time. Stay safe.